Okay, so today I came live to interact with my followers and to say a big thank you to everyone who has followed my page. Okay, so I'm going to teach about a very, very important topic. Yes, so please do not go away. So maybe you are pregnant and you've been told that you have placenta previa. Placenta Previa. Please, if you come live, say hi to me. Type where you're watching from, or like just pass a comment. Let me know that you are here. Okay. Yeah. So placenta previa. So what is placenta previa? Before then, I'll define what a placenta is. So when we say a placenta, so placenta is what carries nutrients from the mother to the baby. Okay, so once you get pregnant, this is how the uterus looks like. This is an empty uterus. Okay, so you see the space here, that is where the baby will be. But until you get pregnant, you do not have a placenta. But once you get pregnant, a placenta is formed. So that is a new organ that is formed when you get pregnant. Okay, and this placenta is supposed to be located um, at the top. Your placenta is supposed to be located at the top. So when you look at this placenta, one thing that you will realize is that this is how a placenta is supposed to be. So the placenta is supposed to be up here. This is the placenta. It's supposed to be up here. Now when we say placenta is previa, the placenta is down. Okay, so if you look at the uterus, this is the uterus. This round thing is the uterus containing a baby. Okay, and this is the mouth of the uterus. This is the mouth of the uterus. We call it the cervix. Okay, so if you look at the placenta that we have in these images, in this image, you can see that the placenta is down. Okay, this one is a bit away from the cervix, but it is still down. Yes, this one is a bit close. This one is almost over the cervix, but not in the center. And this one is central. Okay, so in placenta previa, we want the placenta to be up like this. Okay, you see this placenta, although this is another thing. Okay, but today I'm focusing on placenta previa. So this placenta is up here. Okay, but then um, in placenta previa, the placenta is located down. Please, thank you for joining. If you have any questions, you can type it. The placenta is down, so you can see it here. And there are a lot of implications that comes with you having your placenta like this. Okay, so if your placenta is low like this, it means that when the woman is going to give birth, this placenta is going to open. Okay, it's going to open, and once it opens, you can bleed. You can bleed seriously, and um, it can lead to so many problems. Okay, yeah. So please, we do not want you to have placenta previa, but it happens. Maybe a previous cut, previous cesarean session, or any other problem. So any of these things, we do not want you to have. In case you have placenta previa, the the things that your doctor or your midwife will tell you to do. Okay, one, avoid sex during pregnancy. Two, you cannot carry heavy loads. Okay, if you carry heavy loads, it can cause you to bleed more. Okay, or it can cause the cervix to um, detach. This is a placenta that is detaching. Okay, so people with placenta previa, if care is not taken, they can have what we call abruptio, where the placenta is detaching. Okay, so it is very important that when you are diagnosed with placenta previa, you work with your doctor, you work very closely. Please, if you have any question, pose the question. I am here to help you. I'll answer any question that you pose. Okay, so it is very important that you take good care of yourself. Okay, you plan your hospital well. You make sure that there's a doctor that they have a theater, they have a blood bank. So theater, blood bank is very important if you have been diagnosed with placenta previa. Don't carry heavy load, don't do any heavy activity. Sometimes it is no hospital, no home, okay, because of placenta previa. This topic is like a very important topic, and I'm believing that a lot of pregnant women will come and learn it. And this is from my book, okay, Sally Tips for Expectant Moms. It is a book I wrote for pregnant women, and it is a very good one. um Sleman, hi. Hi. I'm happy to have you here. So I came to talk about placenta previa. Placenta previa means that the placenta is low lying, okay? And when your placenta is low lying, it can have several problems or several implications, which is not good for the mother, okay? Which is not good for the mother, okay? Yeah, so thank you so much. If you have any questions, you can answer me. You can ask me, and please, if you know any pregnant woman, please let them subscribe to my channel, because I'll be giving more education, more teachings here. Let's reduce maternal mortality in Africa. Okay, let's reduce maternal mortality in Africa. Yeah, thank you so much, Salman. I'm very grateful. Yes, so I'm very grateful. This is placenta previa. And one, how is it diagnosed? Somebody will say, how is it diagnosed? Through a scan. Okay, through a scan, a placenta previa can be diagnosed through a scan. Okay, and if you've been diagnosed, you take good care of yourself so that you do not bleed, or you do not have any other problem. Okay, thank you for watching. I think I've said all the essential things I have said. Plan your birth, and mode of delivery is cesarean session. If it is very severe, cesarean session. Okay, we have a pregnancy class that I take questions one on one too. You can sign up for our pregnancy class. Yeah, thank you so much. It will still be on the page, so you can share it with your friend who is pregnant. Please, if you have anybody who is pregnant, let them know that I have a YouTube page, and I'll be doing live classes from now, okay, on my YouTube page. Thank you so much. Have a good day. Bye.